Hi everyone, in this video I want to talk about uh, the cancer related uh, topic, but it's not exactly about cancer, it's about breast cancer. I saw recently a couple of articles about in Indian media where a few years back I had seen that actress Mahima Choudhary had got the breast cancer treatment in India, and then a few months back I think there's another actress, TV actress, who was getting a breast cancer treatment as well in India. And at that time, the concern that came to me from my own experiences with medications in recent years in India was that earth pollution has also had an impact in the quality of medicine and food we get in India. So, as a result, what I found, which happened with me, and it's not simply just earth pollution. Part of the problem is just simply the way medications are do get manufactured. So, if a company usually has some standard protocols for the amount of ingredients that a medication might have in it, and if you are prescribed X medication, that same X medication can be given to you manufactured by company A or company B. So if company A manufactures it and B manufactures it, and both are manufacturing 100 milligram of a drug, it's not necessary that every ingredient in your medication would be the same. So company A's 100 milligram of the drug might look like a 1 centimeter tablet, whereas company B's same 100 milligram tablet might look like a 2 centimeter tablet, because they also have other ingredients in a tablet other than the medication itself. And then apart from this brand to brand variability where the ingredients will be different, if the company now manufactures that same medication in 10 different facilities in India, again based on the way the company, the manufacturer is doing their business practices, we can have medications that can be very different or slightly different from a medication that is maybe manufactured in Maharashtra, might have a slightly different composition than a medication, even if the company's same standards are being followed. Then also the same medication made by the same company A in Maharashtra might have a slightly different composition than one that is manufactured in North India, than one that is manufactured in South India, than one that is manufactured in East India, because each of the different states of India might have a different things going on systemically within the companies of those areas. There could be things going on within the pollution levels of those areas. There could be certain things that are standardized and normalized as a safe business practice but may not be actually a safe business practice. Sometimes the difference in tablets could or ingredients could happen because while the tablet was getting manufactured, some malfunction could have occurred which no one understands that the manufacturing hassle has occurred. So as a result, there is no, even though policies are very standard, consistency is meant to be maintained by different companies. Sometimes it's not possible to have the consistency because of the variability in a facility, variability in the policies of the facility, as well as variability in the manufacturer procuring the ingredients that they will make a tablet from. So what happened with me a few years back, about 7-8 years back, or even 4-5 years back, whenever I used to get there are some medicines I occasionally take, like something for period pain or fever I would take when I get simpler flu like symptoms. So few years back when I got a flu like symptom, I was given medicines, and one of the medicines was acetaminophen medication, acetaminophen, which is called Tylenol in US, and that's the brand name. And acetaminophen is the generic name of that medication in US, and in India, it's called either acetaminophen or paracetamol, and other brand names like Crocin, Metacin were the brands I am used to using when I was a kid. Now, as an adult, they gave a different brand. I don't remember the brand name because I don't keep the memory of different brands that you get in India. So I don't even remember the brand name. But that particular medicine, when I took that medicine, I got intense pain in my hand and whole body. And a few years before that, I had experienced similar kind of very intense pain in my body, and I didn't know why I was getting this intense pain at that time. I hadn't self reflected, I hadn't got anything tested, but I had always felt as since a child that I had low bone density. I have other family members who are like really sturdy and hefty, and looking at them and their weight range and other things, I just knew somehow that I have very low bone density. So, and I have also had in the past in US some vitamin D deficiency as well, which could have impacted my bone density related issues. So when I was in India, I didn't know at that time, I hadn't done any standard checks to know whether I have any deficiencies going on, but I'm sure I was going through some deficiency phases. And in my past videos, I've told about the pesticide exposure related problems I had with health. So my pesticide exposures had happened in US as well as in India. So that pesticide exposure had been continuous for a few years, or at least once in a few years. So at that time, though I didn't correlate my bone problems or health problems with pesticides, all I knew was something was going wrong with my body. And in this video, I also want patients or people to understand that when you have one particular health issue occurring in your body, it doesn't mean that there's only one culprit for that issue. So only now I'm realizing that my bone density problems or vitamin deficiencies or other things could have also enhanced my experience of the bone ache and pain I was experiencing when I took this Tylenol like tablet. And similarly, few years before that, I had also experienced bone ache and pain, but at that time I was not taking any medication at all. So how did I get bone aches and pains 7-8 years back? At that time, I was very my favorite non-vegetarian food to consume was eggs. So I used to eat eggs every day in breakfast, or if not every day, 3-4 days in a week, I would have eggs as breakfast. So after a few days of consuming a certain batch of eggs in my home, I started getting this bone ache and pain. And initially, I also started smelling a strong preservative smell in the omelette I had prepared. And my omelette didn't really have anything except egg and a little bit of cheese and a little bit of tomato sauce and maybe chili pepper or something. So it was very mildly made. And when I ate that, at the time I realized that that preservative smell was so strong. I felt maybe it's from the processed cheese slices that I had made, that I had put in my omelette. So I first started looking at the cheese slice, and next day when I consumed the omelette, I didn't put any cheese slice. Then also I got the smell of preservative. Then also I was getting bone ache and pain. At that time I thought maybe it's the tomato sauce that is the problem, because that also can have preservatives. This is how processed foods are. You will always have processed foods, and medicines all have preservatives added to them. Even cosmetic products also have preservatives added to them, which are added usually so that the product doesn't spoil sooner. And that's why we also have all these processed foods will have a expiry date also, in order to ensure that you're getting a clean product when you are consuming the product, a bacteria free, microbe free product for your consumption. That's why they put preservatives in them, to preserve any kind of bacterial growth from happening in the food or the medicine. So I took off taking the ketchup also. Then also I was getting this bone ache and pain. So where was that stemming from? Finally I realized it was the egg itself that was having some preservative in it. And again, in India, usually if you were younger, and when I was growing up in India, when we used to go and buy eggs from the market, sometimes you will have bird poop on the eggs, and the eggs don't look as healthy. So when there's bird poop stains or eggs don't look healthy, when you're shopping by yourself and you're not buying it, like in US you get those cartons from which you buy, or in India in online retail also you get these cartons of half dozen or 1 dozen eggs. Here in our local shops we usually get that same half dozen 1 dozen egg, but the local shop is allows us sometimes to pick the eggs we want. So at that time, obviously, customers do not want those bacteria stained, poop stained eggs, right? So now, what might have happened over time of marketing these eggs? People might have realized that because the eggs that don't look clean are not getting bought by customers, they might have started cleaning the eggs or washing the eggs. But if they are washing the eggs in a pesticide laced water, or they also wanted to sell the eggs longer, they might have started adding preservatives in it, so that if their eggs are not getting sold, the preservative will not rot the eggs sooner. So because of which I think the business practices might have started in India, where eggs were getting these preservatives. And at that time I had just barely come back to India, so I had a whole 13 years of gap of not consuming any eggs in India, or rarely, like over my occasional trip to India I might have consumed eggs in India once or twice in a week or something. So I wasn't at that time a regular consumer of eggs. So I might have consumed one egg a week or one egg a month during my entire trip to India. So that's why my body was not used to, if the preservative levels in our food is slightly increased over time. So if 10 years back what preservatives were there in our food, if it was like say 0.1 ml of preservative, right now if it is 0.2 ml over 10 years time, a person who has not lived in a country for 10 years, on them the impact of something changing will happen, because they have not been used to that slow degree change that might have transitioned over a decade. So that is what happened to me. I was not used to eating eggs in India, and maybe in the first few years I was in India, I don't think I got the allergy issue. I don't remember it very clearly which year I experienced the pain with the egg preservative. But I realized that the preservative was in the egg. We tried buying eggs from different areas, but this local area had that preservative which was giving me extreme bone ache and pain. So as soon as I found that it is coming from the egg, I stopped eating egg. Then I also got in a phase of life where I started slowly deciding that I want to become completely vegetarian now. So because I was in that vegetarian type of phase, in the last 8 years I have hardly consumed any eggs. So at that time, when I took this medicine, when I was having a flu-like symptom, and the doctor prescribed me this pain medication for my fever and pain. I didn't have pain, but she still gave me that medicine for fever. So when I took that medicine, I again experienced that pain. In that tablet I couldn't smell the preservative, but being a pharmacist and from the pharmacy profession, the likelihood of the pain occurring from the preservative was most likely, because over the period of my life since childhood, many a times I have consumed acetaminophen based products for fever. So that was our family's go to medicine for if you have some fever due or flu like symptom. At that time, if you are experiencing pain, body aches, at that time we used to consume this, or our doctors used to prescribe this. So that was a very standard thing. So again, even though for me, again, Indian medicine or buying medicine from India was not something I had done for over a decade. So again, if any slight changes in the formulations had also happened, I would have, my body was not used to that. This being a different brand than what I usually used to buy, again, a different brand will have this variability of having a different concentration of preservative in it. So when I found that the medicine is causing me body ache and pain, and I was only getting very mildly feverish, I hardly took 1 or 2 tablets, and I didn't take the after 2-3 tablets. I didn't continue the rest of the tablets. So this is what you should do when you have a side effect from a medicine. It is a standard therapy sometimes taken by doctors, suggested by doctors, and in US pharmacists suggest this to their patients, that if any side effect is occurring from your medicine, you might have to stop taking the medicine, and you might have to ask your doctor to change your medicine if your medicine is not working or causing extreme side effects for you. But in India, this kind of practice doesn't happen. Patients get medicine, but they don't know that their medicine can cause them a side effect. And if their medicine causes them a side effect, they also don't know that because of the side effect, if their health is getting worse, they have a right to ask for suggestion of a different med. This should be considered as a basic human right, because I feel it's like a cruelty if you prescribe something that is harmful for someone. When something is beneficial for someone, it is not a cruelty. Giving medicine is a benefit, it is a positive thing. But if that same medicine is going to harm you or is going to add to your harm, at that point of time, you can't tell that the medicine is you need to analyze the risk versus benefit of taking a particular medicine. So now in the case of Mahima Choudhary, I couldn't find the original article. I don't know whether it's not showing up in my Google search, or if that article has been removed from online posting. But this was from again a few years back, and at that time when I read the article, I found it very strange because it was a newspaper article, so it was not a very scientific piece. But even though it was not a scientific piece, the actress Mahima Choudhary was mentioning about her cancer. And when she was mentioning about her cancer, or someone was writing about her cancer treatment, in that it was written in that article that the doctors, when they were interviewed, the doctors were puzzled that in her body she didn't have certain receptors that for breast cancer treatment, those receptors should be present in someone's body. Now, because she didn't have those receptors, what I was surprised was the doctor still gave them the therapy despite her not having certain receptors that the drug would act on. And again, because I haven't practiced as a pharmacist, I don't know what are the current drugs used for breast cancer, and because of which I don't know what medicine she was prescribed. I also don't know what receptors the medicine should have acted on for her. But there were apparently, she had something called triple threat or something in her diagnosis, and a triple threat which I'm sure would have sounded scary for her. But because she had this triple threat thing going on with her, and because she had no receptors for some of the drugs that she was getting, I felt at a time, my intuition told me that this was not the right treatment that was given to her. Because if when you're getting treated by something, if you know this is your body's receptor, a receptor will have these gaps where the medicine can sit. So if this is a receptor, okay, these bars are the receptors where a drug has to act on your body. If you have this receptor in your body and this is your drug, the drug will be made in such a way that it will fit exactly in between here, like how this is fitting. So it is meant to fit exactly within that hole which is the receptor has created for the drug. Essentially, the drug is being made by the manufacturer in such a way that if you have a certain shape of a receptor in your body, inside that the medicine will fit well, and when the medicine attaches to the receptor, it is supposed to do its mechanism of action on your body, right? But if you don't even have the receptor, where is that medicine then going to go and act on if you don't even have any receptor in your body? So that's why if she didn't have any receptor and she was still given a medication for something that she doesn't even have in her body, then that medicine is simply just getting absorbed by her and then eliminated by her body, because there's no place for the medicine to even act in her body. And then if she is getting couple of medications for the triple threat or whatever, and she one of the videos that I saw, she was crying about it because it might have been a painful experience. And while her family is like, why are you crying or why are you bothered, you don't understand that when you have real cancer, or the bone ache and pain that you can experience, the body ache and pain that you can experience when you have cancer. And I have had, my grandmother had cancer when I was younger, so I had seen her suffer through the cancer pain as well. So because of this reason, I felt, and not just simply this reason, but I do know that in US, if you get therapy, if you get the same therapy in US, and you are having problems with, if you don't have receptors, if you have a good doctor in US who is educated in the same way as I have been educated by the US healthcare system, and clinically educated by them, even though I didn't finish my clinical degree related to pharmacy, but I have at least half a knowledge about that degree. So with that half knowledge, I can tell you that if you are having there's a protocol called evidence-based medicine, there's a protocol called patient specific therapy management, patient directed therapy management. In all these protocols, you are essentially giving therapy to the patient based on the factors related to the patient's body and health status. So even if there are hundreds and thousands of patients you might have treated with that drug, which if she has to have a receptor X in her body, and that drug has to, the way the drug acts is it acts on the receptor X, but if her test showed that she doesn't have the receptor X, you cannot give her a drug that doesn't even have a substrate for the drug to act on, a receptor for the drug to sit on to do its mechanism of action. And this thing, a person who's well versed in pharmacology, who has similar degree programs as me, and someone who's got the right clinical insight will know when this is, whether this is right practice or wrong practice. And apart from that, if even after that they judged that let's just give her this drug because it's common practice, but if the patient is experiencing pain, patient is experiencing, she said she couldn't get up from the bed, she was having a lot of disability like condition where she couldn't move from her bed, when she's getting that condition, that also means that you are supposed to change the medicine, adjust the medicine dosage according to patient's health status. So these things didn't happen with her. Now her therapy has been done, but there are still new patients who get diagnosed with diseases, not simply breast cancer, but multiple disease patients get multiple diagnoses with multiple meds. And all of those patients, especially in a heavily densely populated country like India, need to wake up that if your body, if you're a frailer person, and people also need to understand sometimes some of these drug dosages are made according to maybe a much more healthier population subset than our body is going to be able to withstand. So that's why also evidence-based medicine is important, that if a patient is a frailer structured patient, smaller structured patient, younger patient, they need a medicine according to their age, according to their body weight, according to their body's needs and health needs. Like if they have lower bone density, then that also might need to be adjusted. If they have other problems going on with their health, according to those problems also your medication needs to be adjusted, and which wasn't happening, which didn't happen with her. But any other patient who's experiencing these side effects have to now fight for patient rights in India if the law doesn't yet account for this kind of a practice where you are, if you are getting misdiagnosed, or if you are getting treatment which is not appropriate for your health, if you are getting treatment that is going to harm you more than benefit you, or if you, multiple patient specific factors need to be addressed. I don't know about the laws because again I haven't been working in India related to these laws or in pharmacy field, so I don't know currently what are the laws in India. But I do know currently what is the practice mechanism of doctors in India, because nowhere, none of the doctors have ever addressed about side effects related to drugs anytime I have visited a doctor in India. And not only that, but because I know what side effects happen, I usually don't go back to the doctor. But I've never heard a single doctor say that if you are having a problem with your medicine, come back and we will review your medication. That is also not there in any standard protocol in India, and I don't know which century we are living in, but these kind of practices were prevalent in US 20 years back, 25 years back, when I first entered US as a and started working as a pharmacist there in US. And in 20 years, I can't understand if we can get Amazon in India, we can get all these big businesses to enter India. How come these simple things related to patient safety, people safety, public health is not getting addressed? Because there's also a mass scale problem. If Indians start getting sicker and sicker, or not just Indians, if any densely populated country of the world gets sicker and sicker, and in that densely populated country, if you pump a lot of drugs into people's bodies for whatever purpose, like if you are ill and they're prescribing you 10 medicines just for safety's sake, and then after giving you the drug, if billions of Indians are taking drugs daily, what is happening to our water systems? Our water systems are getting contaminated daily with those medicines, and then you will have drug related healthcare symptoms. When in modern life, the young children who are being born, there are certain children who are born with genetic defects. It could be because of the medication that is there in their waterways, or other chemicals that are there in their water systems that their parents are consuming daily, which could have a health impact on a child. If a person has not congenital birth defect, but after birth there are, when infant deaths happen, there are infants who could have died because of whatever chemicals were there in their local air, water, clothing. So all these things need to be addressed, because a billion populated country cannot handle the pressure or excess toxicity from multiple excess chemical usages anymore. That's the reason why actually cancer is rising, because health supportive conditions are decreasing. Not just cancer, multiple diseases which are dependent partly from maybe your body aging, but part of the factors responsible for our poor health is not simply the aging, but the unclean water we have, the unclean food we have, the chemical laced lifestyle we have in densely populated places of the world. And it's a global problem, it's not an India specific problem, and people have to realize and wake up to this, because medications from densely populated country where manufacturing laws are not as strict as in a developed country is the reason why medications from our country, like India, countries in Asia and Africa, go to US and Europe. So if US and Europe also want healthy medications to come and land on their doorstep, they also have to realize that the pollution they are dumping on our country can't continue happening. And because that will that will have a reverse effect eventually, when all those medicines are being sold in your countries and used in your countries. And Indians actually are, in some ways, we're not hypochondriacs, so we don't consume mass scale medicine. Most Indians consume only the medicine that their doctor prescribes, or if they are getting simple cold and flu symptoms, sometimes they will go and take a anti-allergy like medicine, a fever medicine by themselves from the pharmacy. Or sometimes Indians go and have some Ayurvedic medicine given by Ayurvedic doctors. But other than that, most Indians are usually practicing home remedies to get better, usually practicing more health safe measures to get better, because that part is there in our culture where we don't take medicine all the time. Very few families are there in India, I know, who are really hypochondriacs, but or who, because they work in and my family was one of those very rare families who are always carrying a bag of medicine everywhere they go, because one side of the family had people working in pharmaceutical industry related work, and the other side of the family had people who are working in hospitals and clinics as doctors. So both consider that taking medicine is the blessing and is a benefit for everyone. But while it was a benefit for everyone when earth was not polluted, even though I grew up also taking medicines for all my health issues, eventually when I lived in US, there were phases of my life I was really poor in US. There were phases of my life I didn't have good insurance. There were phases in my life I just didn't have anyone to take care of me. So in all those times I didn't take medicine. Very rarely I took medicine. And because I didn't take medicine and because I was selling medicine, I knew deeper at that time what are the side effects associated with medicine. And because of that, both of them combined, I understood finally that if we don't minimize the use of our medicine, we will not have healthy patients. And while I was realizing it very slowly as a person who was doing my clinical degree in US, eventually when I moved back to India, the actual impact of over medicated water supply systems or over chemical polluted water supply systems in India is something I am experiencing while I'm traveling in India, while I'm going to those places where we might have had extra chemicals in the water from different sources. So, all of which does impact our health, does cause people to get worse and worse in health. And when there's multiple chemicals in someone's body, it is harder also to treat them easily via medicine. So, that's why it's much more important and crucial for current doctors in India to wake up to what harm they are doing. And because every doctor has taken this oath of do no harm, and even though they have taken this oath of do no harm, they're continuing multiple levels of harm in multiple people's lives without awakening to it, without having an awareness about what harm they are doing. And if doctors also don't wake up, patients have to wake up. Because if you are going through expensive cancer therapy, painful cancer therapy, expensive or painful or cash strapping therapies which are asking your family to donate lakhs or crores of rupees for your therapy, and you are a low socioeconomic status person, you can't do that therapy when you are in a low socioeconomic strata. At that time, how much ever your doctor tells you, you have to spend lakhs and crores of rupees for this therapy. I would suggest do it only if the patient is direly needing that. Go and consult a couple of doctors before taking up any therapy that asks you to spend lakhs and crores of money, because there are many patients who do not need that lakhs and crores of therapy at all. There are also many patients who actually, after therapy also, there are patients, I have seen patient stories in People of India and other online websites where there are mass scale patients in India who have gone there, got therapy for cancer, they recovered from cancer for a few years. And not just India, this is true also of US patients. In Patient Story website, you can see their medical gaslighting and medical journey related stories. In all of these stories, the common thread is that if there are certain group of patients who had cancer, who got cancer therapy, after therapy, after 2-3 years of therapy, they again got their cancer back. Either the same cancer came back to them or they got a different cancer. And in both cases, the one who gets the same repeating cancer and the one who gets a diagnosis of a different cancer, the main culprit for their cancer is their environment pollution of the place where they live. The one who's getting repeating cancer of the same kind is likely living in the same locality, has never moved from that locality, and has continued living in the same place and has got all kinds of earth pollution health problems based on the location where they have resided for years or decades. Whereas someone who has got two different kinds of cancer, it is possible that they might still be living in that same house, but it is also possible that that person might be a traveler, and that's why exposed to different areas, different kind of pollution, or that person might have migrated from one country to the other, or they could be a person who lived in city A and now they have moved to city B. So while in city A, the pollution parameters led someone to have breast cancer. In city B, instead of breast cancer, some other cancer came up in their diagnosis. So all of these are pretty much possible. And about breast cancer, the final thing I want to talk about, which has been annoying me in the last few years. Every time I go and try to purchase a bra, there's no health safe, women safe, comfortable, good quality material bra available in India. From the most expensive brand I have purchased it from and the least expensive brand, they do not have. Very rare brands have actually good quality bras for women. And there was actually some kind of a survey somewhere in a game show like thing where apparently this survey showed that women are the thing that women spend a lot of money on finding. One of the article of clothing that women find a lot of hard time finding nowadays is underwear. And I have found this problem with bras as well as our underwear, which are both a women's health concern, because with the materials or chemicals that are being used in these underwear material or even women's clothes, the thing is, if your underwear has chemicals in it which is harmful for your health, in my previous video when I talked about the women's health issue related to periods, people need to understand that if toxic chemicals are getting absorbed, if you're wearing a cloth which has toxic chemical in it, and that underwear you are wearing and absorbing continuously, every day you're wearing that underwear, every day a little bit of some toxic chemical might be getting absorbed from your clothes, partly from the earth pollution in your area, but partly also from the basic material of the underwear that you have purchased from the store, which might have put some dyes in it, some chemicals in it and other things. So the material, the dyes, the chemicals, whatever they are doing in current women's clothing, I don't know, but they are certainly rising, increasing women's health problems. And again, our country cannot do with the burden of excess surgery also anymore. If water pollution is going on, air pollution is going on, food pollution is going on, neither can our country sustain the burden of excess or over medication of any population. So this problem needs to be solved. And with the bras, the companies have come up with this strategy of fine net like material being put in the bras, which will do what? When you wear a bra, and they have put it strategically exactly in the area where it will irritate your skin, it will rub against your skin and give you eventually breast cancer, exactly where breast cancer usually gets detected. So if we wear clothing which are continuously harming us, these laws and regulations need to be changed, that if companies know that this material is harmful for someone, and it seems like a very strange thing that in the last 4 years every kind of high-end market bra that I have bought has had these kind of problems, like poor quality materials which are not breathable, materials which are made of these net like materials. So if it is not a breathable bra, again, excess sweat accumulation, toxic accumulation in your breast area will eventually end up causing breast cancer. Same way, if you are wearing a lot of net like material which is rough nylon synthetic material that is rubbing and abrading against your skin, you will get that. Imagine now if some woman comes up and creates a man's underwear which is going to continuously chafe against his nether regions. What is going to happen to them? They are also going to get excess cancer related to their reproductive organs. Then do we want a world like that, where everyone is just simply suffering from a meaningless disease and continuously popping pills? You can continue popping pills, but eventually the pill popping is also going to cause us harm and death, and more likely to cause us harm and death in this world where excess pills are being used and excess pollution of every kind is going on. And this has to stop. If you don't stop it, majority of the world is going to die in the future, because there's no other trajectory left for humans to have in the future. If you don't have health supportive, real safe clothing, food, medicine, anything, because you think the earth pollution is not going to impact your medicine. I have found earth pollution to impact your medicine as well. There were some stories I read where I felt that the person who took those medications likely didn't have good manufacturing practices in their facilities, because of which the person who consumed the medicine from those facilities ended up dying. And they might have been following every protocol possible that is there in the guidelines, but if ignorance is present in any element of what work they do, and in India mass scale ignorance is currently present, simple ignorance of not understanding that if you take a bribe of 1000 rupees or 1 lakh rupees to even cause 1.1 milligram of some microbial contamination in your medications or biochemical contamination in your medications, while you got that benefit of 1000 rupees or 1 lakh rupees by contaminating a product, or someone was just simply out of grudge for their boss contaminated something and ran away, you don't understand that the repercussion of that same medicine that you have contaminated is going to follow you. Because like you, there will be in one place, if worker A has contaminated because he has grudge against his boss, and in worker B has contaminated in another place because he got a bribe, and worker C is contaminating because he is ignorant about everything, so he doesn't even follow the standard protocols that his boss has given him in writing. So in all these cases, eventual karma of all these four people is going to be the same, that someone eventually who takes that medicine, they themselves might take that medicine, their family might take that medicine, and that 1000 rupees that you got as a bribe or 1 lakh rupees you got as a bribe will eventually get used up, or more than that will be used up by you for your treatment or your family's treatment. Or if you did it maliciously, you think someone else will not maliciously end up karmically doing something to you and your family for what you have done maliciously, or and even if you do it with ignorance, how much can someone's ignorance be forgiven if you are an incompetent worker? So these things need to be addressed, that if you have incompetent workers in India, in globally, multiple religions talks about forgiveness, but forgiveness is where you are truly ignorant. But some people are not ignorant, simply truly ignorant, they are lazy as well, they don't want to follow protocol, they are lazy, they are impudent, they don't want to follow protocols given to them because they just want to do a quick work. And that in this age of quick work, not paying attention to work, all of these are critical places where, in manufacturing places, in any element of food related work, clothing related work, anything related to human activity essentially needs focus attention, needs people to be really dedicated to their work, consider their work as something greater than just simply something that gives them a paycheck. If you're not doing that kind of a work, please don't do that work. Go and find a work that is aligned with you than sitting and wasting a job where real critical work needs to be done right now on earth. Because if mindful people, critical analysis oriented people don't do the right work, earth is going into a trajectory of much more mass scale deaths than what has happened and unfolded currently during COVID. People don't realize it, but that is the only trajectory left because of incompetency, because of malice, because of ignorance, because of lack of capacity of even educated people who have studied these degrees that I am talking about in this video and who practice medicine. Despite that, they do not understand how to practice medicine in the right way. And this needs to change. If it doesn't change, you are on a trajectory towards painful deaths, because I have suffered as a result of all these things that I'm mentioning in this video. Personally suffered from not finding a doctor who understands that if my certain health status is critical, they're not critically analyzing my data. So other doctors are not critically asking patients the right question. Other doctors are sitting and wasting time and not even discussing with each other, even though they work in the same hospital, they have no time to discuss with each other a particular patient's case. Other doctors don't care, like as long as they've got the money for a test, the hospital doesn't care if the patient doesn't get a follow-up after the test has been done. What if that patient is so severely sick that they can't come for a follow up, and you are meant to follow up with a patient to ask like, can you come for an appointment, your data shows that some serious illness is going on. That kind of irresponsible people, only very few responsible people of that level I have found in healthcare practices in multiple places in India. Very few people are that careful, that follow up oriented, that true patient care oriented in India. And there's a reason why brain drain happens in India. Those people who are competent people who want to do good work don't get any appreciation for the good work. Instead, they get backstabbing from their co-workers. Instead, they get malice from their co-workers for being more competent. That also happens in India. So you think people who are really competent, really work focused, really ethical would want to stay in a country where ethics is so messed up, or competency is so messed up that if you are competent, you're more likely to be kicked out of your job than kept in your job. So these things have to change in India. When it will change, I don't know, but if Indians really want to have a healthy life, this is where every Indian has to focus on, or not just simply India, this is where everyone who is in a similar country like India has to focus on if they really want true health, true health care, true balanced healing, true balanced life to unfold for them in their future and also in their present. In all our present, some mass scale health problem is brewing, where people mass scale or complex or multiple levels of health challenges are brewing, from physical health to mental health to emotional health to psychological health to spiritual health related problems. And this is unfolding because when things have to be fixed, when things are at a point of no return, there is only two choices left. You either choose the path of no return where you will go worse and worse, or you come back to the path which will realign you back to better quality life, better quality health, better quality ethics, better quality ways of living, because better quality ways of living does exist on earth, and pockets of the earth have woken up to what is better quality living. But now that pocket of information that you have about better quality health has to be integrated into a much higher level if you truly want a completely better quality health to unfold on earth. If anyone has any questions about anything I presented in this video, please drop a comment, and I would like to hear from people if you are facing challenges with your medication usage, or in general you have been seeing a lot of doctors but have not been able to resolve your health issue. A comment would be helpful, because then maybe if enough comments are there, something can be done with those comments. I hope this was educational and informative, and thank you for watching.